A study published today has found some misinformation starts at the top, including the publication of dodgy research and poor communication. Dr. Lisa Parker is an honorary lecturer in the School of Pharmacy at the University of Sydney, and she joins us now. Lisa Parker, welcome. So how did you approach this study?
Well, we were interested in seeing what was going on across the whole breadth of science research and communication to the public. So we spoke to researchers around Australia, we spoke to people who research misinformation and science quality, and we spoke to science communicators throughout Australia as well. And it was really interesting to hear their comments. Yeah,
it's just so good that someone's taken a good look at this, because it's been just so unfortunate about the amount of misinformation that's been around. So what did you find about the sources of misinformation? I understand you grouped them.
Yeah, so we listened to what all these experts were telling us, and from what they said, there were concerns about the quality of the science that was being produced. So some were quite concerned that what we call bad science or dodgy science was produced, and that encompassed a lot of things. So sloppy research, maybe biased research, but also outright fraud. So there was concern about that. And then there was also concern that the research perhaps wasn't being communicated in a way that was accessible to the general public. So there might be paywalls in the journals, for instance, and people couldn't access it. People who needed, policymakers couldn't access those research studies. And then also the communication in the general media. So how easy is it to get really good, reputable science journalists to have the time and the resources to communicate and translate, if necessary, that science research? So there were a lot of concerns across the whole board.
And so give us a specific example of where research that probably hadn't been finished or hadn't been properly reviewed ended up being published and influenced what people thought.
So there are plenty of examples from across the pandemic, sadly. And we organised a few examples when we were speaking to the participants in the study to give them a flavour of the kinds of things we're interested in. So perhaps one of the well-known ones comes right from the beginning, January of last year, 2020, when a preprint was released. So it hadn't been peer-reviewed. It was released on a general preprint server, talking about the molecular structure of COVID and using some terminology like it's uncannily similar to HIV and perhaps couldn't have evolved, unlikely to have evolved naturally. And that just went nuts across the world, and people picked it up. And the researchers actually pulled it down from the server within 3 days and said, look, we didn't mean to sort of spark off these conspiracy theories about bioweapons, but it had already gone through everywhere.
And so to what extent has that particular example influenced thoughts around the pandemic over the subsequent 18 months?
Well, we've seen a lot of concern about where this has come from, haven't we? And people are still looking, aren't they? Right now they're looking in Wuhan and to see if they can find out the source of the virus. But there are plenty more examples like that. There was another study done in France that was quite a small study, just 36 patients, an observational study. It was released very early on YouTube. Donald Trump tweeted about it, about the apparent benefits of hydroxychloroquine in treating COVID-19. And that also just went nuts around the world, and we saw chloroquine shortages. People died taking chloroquine, very sadly. And that study's subsequently been discredited and probably, missing data, sloppy research, whatever. So these have real-world harmful consequences, these poor quality studies.
So you looked at that, but also to what extent did social media influence misinformation through the pandemic?
Yeah, look, presumably played a big role, right? So as I said, that one was released on YouTube and it was tweeted. So social media certainly gets the message across, but social media is here to stay, Look, we're not going to take that away. We have to learn how to manage this and upskill ourselves as a public so that we can work out what's reputable and what's not reputable, what we should listen to and what we shouldn't.
Okay, so let's take a look at it at a few stages then. How do you prevent the bad science or preliminary science that hasn't been peer-reviewed becoming public in the first stage?
Yeah. So it's a multi-step problem, I suppose. So we need stronger education about researchers. We need things like funders to insist that the research is high quality, so that studies should be pre-registered, so researchers can't kind of change their minds about what they're looking at after the results have come through. They need to stick to the original plan. We need good quality peer review that is perhaps transparent to people. I actually think, from what I heard of people we spoke to, they weren't necessarily against public access to preliminary research. So preprints, many people thought preprints were good because they were a rapid way of disseminating information, which is important, right, in a pandemic.
But is the public equipped to properly interpret that?
But we need to equip the public to understand the limitations of a preprint server. So it's preliminary. It hasn't been scrutinised by an expert. But that doesn't mean it doesn't have a role to play.
But presumably there are already pretty strict global standards when it comes to adequate academic publication.
Yeah, there are, but sadly doesn't necessarily translate. People don't stick to it. So there's been rules about you have to have your trials pre-registered in order to get them published, but it just doesn't always happen.
And so realistically, are you ever going to be able to do this globally? Because there are going to be random people all over the world.
Well, I think if we get institutions on board, so the institutions insist upon it, if we get funders on board, so that funders insist upon this sort of pre-registration and open access to the original data, then I think researchers will have to do it, and they will follow through.
Okay, Lisa Park, unfortunately we've got to leave it there. I can talk to you for a lot longer. But if people want to see your work, where do they go to a reputable publication?
Well, we published in BMJ Open Science, and yet that's freely accessible. It'd be great to see a public reading it, and I'd be interested in their thoughts.
Good stuff. And yeah, good on you for researching this, Lisa Park.
Thanks so much
for coming in.
Thanks very much.